Hello, my name is Dr. Kristen Scholl, and I've had the honor and pleasure of serving Bucks County Smiles patients here in Yardley for about 10 years now. And one of the things that I provide to our patients is airway therapy or treatment for sleep apnea or sleep disordered breathing. A lot of patients have a question, what exactly is sleep apnea? I hear this term thrown around a lot, especially recently in the news. So sleep apnea actually refers to the process where when we fall asleep, our airways become more lax. And some of us have more crowded airways than others, or smaller airways. And what happens is that the tissues actually collapse on themselves, or the tongue can fall back and block the airway. And what happens with a blockage like that, and it can last anywhere from a couple seconds to a minute, is that the oxygen level in our blood drops. So we're not breathing for an extended period of time. Our bodies don't do well with no oxygen. And that increases our risks for many health problems, such as hypertension or high blood pressure. Increases our risk for heart attack and stroke, as well as risk for depression, dementia, and reduced cognitive abilities. So really, when we're talking about something limited to the airway, it's actually much more than that, because when you're not breathing, your body is not functioning to its utmost, and it suffers along the way as a result. There are a few different ways to treat sleep apnea, and we offer a few of them here in our practice. So one way to treat sleep apnea is with an oral appliance, and an oral appliance has to be provided by a dentist trained in sleep medicine. And what it does is it positions the jaw such that we don't get as much of or we don't have those blockages happening when you're wearing the appliance. Another way to, either in addition or alternatively to this appliance, is some patients suffer from narrow airways because their teeth are positioned narrowly, or they have narrow jaws, which leaves them with no room for their tongue. And so what we can help with that is by correcting the position of the teeth, or widening that space through something like Invisalign, orthodontic therapy. We can actually lessen the severity of a crowded, narrow airway. Many patients come to us at Bucks County Smiles seeking the oral appliance for sleep apnea because they've been through the trial of something called CPAP therapy. They've been prescribed a CPAP by their physician. And CPAP can work great in theory, and what we find, unfortunately, is that it's so cumbersome to wear a mask when you're sleeping that about 50 to 60% is all we see in terms of compliance. So most patients, when they come in, they say to me, yeah, I have a CPAP, I hate it, I wear it maybe once or twice a week. Is there anything else we can do? And fortunately, the answer to that is yes, in most cases. The oral appliance will be very helpful to treat mild to moderate cases of apnea, and even some severe cases of apnea. Bucks County Smiles is different from your average run-of-the-mill dental office because we have made it our mission to incorporate medicine into dentistry. So we take the whole patient into account. We talk you through your desires, your needs, as well as incorporate your medical concerns, your healthcare providers into the process. And we use that to develop a comprehensive treatment plan, something that works for you. We walk you through the process step by step, and we're here for follow-ups after we provide a therapy to make sure that it's successful and that you're happy with the outcome.